Hello friends, today we'll be reading mercury poisoning. So first of all, it is also known as quicksilver. Why? Because in room temperature it exists in liquid form. That's why it moves really quick, and that's why the name. In room temperature it look like this. And mercury exists in different poisonous form. That is, it can be organic form, it can be mercuric form, and it can be mercurous form. Organic form is the most dangerous form. Here the organic poison generally is methyl mercury. It comes from the fish, shellfish. Remember those biomagnification concept? It's same. But actually the most common form is the mercury chloride. And also it's found as corrosive sublimate, means very pure form, and it's highly poisonous. And its fatal dose is 1 to 2 gram only. So here is the MCQ. What is Donovan's solution? I think you people have heard about it. So this is the mixture of arsenic and the mercury. We have read about arsenic, right? And we use it in treatment of sexually transmitted disease. Now coming to the type of mercury poisoning. First one is acute poisoning and the second one is the chronic one. So which is dangerous? We will see it later. And this chronic poisoning also known as hydroxyzism. Now coming to the presentation of acute poisoning, a person will come with breathing difficulty and pain. And it can affect our GIT system and kidney. In GIT, it can cause diphtheria-like membranous colitis, also called as pseudomembranous colitis, and a patient will present with a severe pain in large intestine. And in kidney, it can cause necrosis in PCT and can cause kidney failure. Now coming to the chronic poisoning. So what is Minamata disease? This disease was first discovered in 1956 in Japan. So what happened here is a person ingests a shellfish which is already contaminated biomagnified mercury waste that come from the factory where the mercury is released. And the mercury or the methyl mercury goes into the fish and a person eats the fish and it shows a neurological symptom in the person. And the second presentation of mercury poisoning is mercuria lentis. What happened here is the mercury deposits in the anterior part of the lens capsule and it gets vague. Now the interesting thing is the lens protein gets changed and it looks like brown and the malt color. That's why the brown malt reflex name came from. But the person does not lose his vision, instead he can see everything clearly. And that's why visual acuity remains normal. In general, we can't see the brown color in the lens, but if we use the slit lamp, we can see it. Now coming to a very important presentation of chronic poisoning, that is tremors. There are different types of tremors. In first stage, the person feels difficulty in writing and there are minor shakes. It's called Danbury tremor. After Danbury tremor, here comes the Hatter shake. So it is the moderate form of the tremors and it increases with the exercise, with the fatigue. And the last one is concussion mercurialis. It is a very dangerous form, the worst of all of them. So this is the progression of Danbury tremor to Hatter's, then concussion. Now coming to the next presentation, that is erethism. So what is erethism? It is a symptom, group of symptoms rather we can say. And we can remember the symptoms from the word sadly. Sadly he is no more. So S for shyness, A for anxiety, D for depression. They develop depression, right? And L for lack of confidence. The person will have no confidence. And the last one is irritability. And now coming to the last presentation of chronic mercury poisoning, that is acrodynia. It is seen in children. And what happens here is the mercurous chloride gets deposited and it shows the bright pinkish shade on the limbs, on the palm of the child. And it seems like someone has colored his limbs and palm. And it is also painful and looks puffy, and also known as pink disease. And the last but not the least, that is treatment. First of all, we do the gastric lavage. We decontaminate the patient, and we can use the chelating agent, obviously, that is BAL, and the chemical we use is sodium formaldehyde sulfoxylate. And generally there is a contraindication. We do not use the ethylene diamine tetraacetate because when EDTA binds to the mercury and form the complex, it itself is a poison and can cause renal failure. And there is a trick to remove all the chronic mercury poisoning presentation, and the trick is made by the maid nurse. So what is it? Mummy shaking head, MMSHEAD. So from the word M, Minamata disease, then mercuria lentis, then sex, then hetershake, then erythism, then acrodynia, and then Danbury tremors. And that's the end, guys. If you found this video helpful, let me know in the comments and show some love and share among your friends.